Hi, I'm Mayor Liz Lempert with today's Coronavirus Daily Update. Today, we're going to hear from our health officer, Jeff Grosser.
What is the difference between the stay-at-home order, or social distancing, self-quarantine, and self-isolation?
Social distancing is a response in which people remain home and distant from each other without any known exposure to the virus to limit possible transmission to or from others. We've heard flattening the curve many times at this point, and flattening the curve essentially means breaking the chain of transmission where individuals are not passing the coronavirus from one person to the next. In turn, this is lowering the rate of infection and hopefully reducing the amount of people needing medical care. Some of these practices include refraining from shaking hands, hugging, or even going to the store at off hours. Everyone in Princeton right now can do their part by practicing some of these things. If people have questions over other social distancing measures they can visit www.princetoncovid.org. Self-quarantine is staying in place either at home or elsewhere for 14 days because you've been exposed to someone who has been tested positive for the coronavirus. Self-quarantine is typically ordered by the local health jurisdiction and/or the state health department. The period of quarantine for the coronavirus is 14 days because the incubation period for the coronavirus is considered to be 14 days. Self-isolation would be isolating within the house after you start showing symptoms of COVID-19, or if you are a person with documented COVID-19 in treatment and recovery at home. Individuals should self-isolate in a room, preferably away from others that might be household contacts. If this is unavoidable, we highly recommend that the individuals that you're living with are monitoring their symptoms on a regular occurrence.
What are the recommendations for following the stay-at-home order, including practicing social distancing when you must go out into the community?
Governor Phil Murphy signed Executive Order 107 on March 21st, 2020, directing all residents to stay at home until further notice. This order provides for certain exceptions, such as obtaining essential goods or services, seeking medical attention, visiting family or close friends, reporting to work, engaging in outdoor activities.
What are the recommendations for best practices during self-quarantine after exposure to someone who has tested positive for the novel coronavirus that causes COVID-19?
People who have been exposed to the new coronavirus and who are at risk for coming down with COVID-19 have to practice self-quarantine. Self-quarantine lasts 14 days after last exposure, as 2 weeks provides enough time to know whether or not you will become ill and contagious to other people. You will be asked to practice self-quarantine if you have recently returned from traveling to a part of the country or the world where COVID-19 is spreading rapidly, or if you have knowingly been exposed to an infected person. Self-quarantine involves using standard hygiene and washing hands frequently, not sharing things like towels and utensils, staying at home, not having visitors, staying at least 6 feet away from people in your household, and self-monitoring for adverse health symptoms such as fever, cough, or shortness of breath. If you do not develop symptoms and your quarantine period has ended, you can return to your normal routine. But remember, the stay-at-home order may still be in effect after your self-quarantine time is over. If you do develop symptoms, you will need to self-isolate.
What are the signs or symptoms that indicate someone who has been under self-quarantine should move to self-isolation?
If you develop any of the typical symptoms of COVID-19, a fever, cough, or shortness of breath, that will be when you would need to self-isolate at home, away from other household members. If you develop these symptoms, contact your medical provider who will provide advice about whether you should come in for testing or if you can stay at home as long as these symptoms are manageable, as you would for a normal cold or flu.
What are the emergency warning signs of serious COVID-19?
If you develop emergency signs for COVID-19, get medical attention immediately. These emergency signs include trouble breathing, persistent pain or pressure in the chest, confusion, bluish lips or face.
When can the self-isolation end?
According to CDC guidelines, individuals with COVID-19 symptoms should self-isolate until their symptoms are resolved and for at least 7 additional days after symptoms first appeared to ensure they are no longer contagious.
What is the safest way to self-isolate one person within a larger household?
If you can, identify in a separate space for a sick person, a space where they can access the restroom without traveling through common spaces would be best. Those who are caring for loved ones who are sick at home should wash their hands frequently, avoid close contact as much as possible, and have the sick individual wear a surgical or procedural mask to prevent droplets spreading through the air.
In households that are not able to accommodate all of these suggestions, what else can be done to limit transmission at home?
If you're not a caregiver, maintaining 6 feet of distance and washing your hands frequently and not touching your mouth, nose, eyes, or any part of your face are the main steps, along with cleaning surfaces often. If you are a caregiver, it's certainly tougher. You should wear a mask if possible and follow the other guidelines of hand washing and cleaning clothes and surfaces frequently.
How can parents and other caregivers help children and dependents who are unable to follow the recommended advice, like frequent hand washing or touching their face, particularly if they need to be self-isolated?
This is the most difficult situation. It's very hard to stay away from kids, especially when they're ill and need care and comfort. If possible, main caregivers should be those who are not at a higher risk for serious complications if they develop COVID-19. Meaning those not over the age of 60 or with underlying health conditions. These include heart, lung, or kidney diseases, autoimmune conditions, or diabetes. Other than that, it's important to take the normal precautions in terms of hand washing and cleaning.
How much can caregivers rely on childcare alternatives, relatives, neighbors, babysitters, in this moment?
In general, it's important to keep the circle of care as small as possible. At the moment, not exposing yourself to many additional people is the best way to avoid infection with the novel coronavirus that causes COVID-19. Healthcare workers, people with critical jobs, and hourly employees who have to work in essential businesses will need to rely on childcare providers. In those situations, you should use someone that you know and trust, and who is reliable in taking the social distancing rules seriously.
What supplies should be on hand for both self-quarantine and self-isolation?
For self-quarantine, you should have your basic supplies like food and liquids and 30 days of any medications that you take. If you should develop symptoms, and even in anticipation of becoming sick, you should have supplies like Gatorade or other types of liquids to help maintain hydration if you develop a fever. Certainly, various types of cough medicines and fever-reducing agents should be on hand. If you should develop symptoms, and even in anticipation of being sick, you should have supplies like Gatorade or other types of liquids to help maintain hydration if you develop a fever. Certainly, various types of cough medicines and fever-reducing agents will help an ill person be more comfortable and get needed rest. In public health, we know that contagious diseases require breaking something called the chain of transmission. The chain of transmission is how an infectious agent can get into a host or a person and then travel from person to person that inevitably will become an outbreak. In this current pandemic, breaking the chain of transmission obviously has to be done on a very large scale. The social distancing measures that we're putting into place, the self-quarantine, the self-isolation that are currently going to work based upon the scale of this are the only tools in the current outbreak. As a result, each one of us is currently taking a role in ending this pandemic.
Thanks, Jeff. I want to thank you, the members of the Board of Health, and the health department for all that you're doing to keep our community safe during this crisis. Remember, we are all in this together.